Healing with Human Connection, where we have encouraging conversations about tough topics such as substance abuse, drug addiction, and mental health issues for those in the Northwest Indiana area. Our hope is to share information that will guide you to resources that can help you change your life so that you can live the life you were meant to live. Check out our website, www.healingwithconnection.com, to find a full transcript of today's conversation, along with a list of any resources or links mentioned in this episode. Enjoy the show.
Hello everyone, welcome to Healing with Human Connections. I'm Jeanne Ann. I'm a therapist and life coach, dealing mostly with relationships, couples, counseling, life transitions. And we have Miss Lisa Scheller, my podcast partner, who specializes in life and health coach and individual and family coaching. She and her husband have written an excellent book called From Fear to Faith that has to do with alcoholism and the family component and the problems and how to recover, and that it's doable. It's a wonderful book, Lisa.
Thanks, Jeanne Ann. Yeah, and the reason we did the book is because we wanted to let people know we're your neighbors next door. Addiction doesn't know any social economic status, and it can happen to anybody. And more that we're coming out of the pandemic, we're realizing that this is a real issue and it's not going to go away. So what can we do to help lift the stigma and get people the resources and help that they need? And so it is our honor to share our story, and if it can just help one family, then we've done what we were meant to do.
Right.
Yep.
Well, it's a wonderful book, and I couldn't put it down, and it is so helpful. So we are thrilled also to have Dr. Hegazy with us. Thank you, Dr. Hegazy, for being here. So, Doctor, can you tell us a little bit about your background and what you do now?
Yeah, absolutely. Thank you for inviting me today. I'm a medical graduate from medical school from Egypt. Cairo, Egypt, moved to the United States in 2004 to pursue my career. I choose to work with the getting like my specialty in psychiatry and addiction psychiatry. Graduated from New York Medical College for psychiatry specialty and Mount Sinai School of Medicine for addiction subspecialty. And getting certified in adult psychiatry and also in addiction psychiatry and addiction medicine, board certified. So I moved to Midwest in 2013 to having that version of being like in the lifestyle of Midwest, which moved from New York City, which was really like a very interesting shift. I've been joining NorthShore now for about 3 years. I was very lucky to be among the team that established the mental health services at NorthShore. We worked together to establish the different services, including psychiatric service, which would be focused more on the establish the diagnosis, providing the medication management for psychiatric illnesses. We also have the psychological services with the 2 psychologists on board with us, including Dr. Scheck and Dr. Merrick. We also have 6 counselors which provide the mental health counseling to our population at NorthShore. And on top of that, we have our specialized program for substance use counseling and co-occurring disorder, which we call it Frontline program.
Yes.
We're also providing that. So that's kind of like work together as a team to establish the different services at NorthShore. I was very fortunate to be among the team working on that for the past 3 years and establish that service. So at this point now, I'm very proud of what we accomplished and what we are working on, even to grow this team and reach out to more community. That would be our goal, and working with the mission of NorthShore and to reach out to everyone, try to provide the best service to everyone regardless.
Right.
That would be our focus.
Thank you, Dr. Hegazy. And maybe for those listening, of course we had Dr. Scheck with us last time who talked about her work. Maybe if you can explain the role of psychiatrists, clinical psychologists, lowly licensed clinical social workers like myself, kind of their general role with someone who's interested in getting help and what's that about?
Yeah, absolutely. So again, like I was fortunate to work with NorthShore, really focusing on that field and providing this like different array of services, which is really like kind of like very, very surprising me with how much they are investing in behavioral health and the mental health, and they try to provide that to the community. Mm-hmm. So basically the psychiatrist and the psychiatric provider, that they are medical provider or medical graduate, they will provide they are specialized in mental health, mm-hmm. and they provide the examination to establish the diagnosis, mm-hmm. and also will provide the medication management involved in the treatment plan in general. Mm-hmm. They can oversee this treatment plan and work as part of the team that provide the treatment for patients who suffer from mental illness and substance use disorder. As we all know, it's not easy to handle such illnesses, mm-hmm. and it's kind of like very challenging. So we need that team, we need that integrated model, mm-hmm. and not even just the behavioral services, but also the other medical specialties like primary care, family medicine, sure. Other medical specialties, which is very interesting. That's what we have at NorthShore. We're kind of like working on this integrated model to provide all together under the same roof. Mm-hmm. So the psychologist would be more focusing on like establish the diagnosis through like more objective tools to do the psychological testing, mm-hmm. and based on that they can come with the data that they analyze, and they would provide that to also the psychiatrist like me, yes. that would have this information about the patient, which is very like definitely in some cases very challenging to kind of like confirm or establish the diagnosis, yes. and we need that sort of like psychological testing like to make sure, to make sure where we are, that like exactly what we're addressing, mm-hmm. and to make sure we are on the right track with the treatment. Mm-hmm. Sometimes it would be also with the challenging cases when we kind of like challenge the diagnosis and we want to confirm if we're really in the right path or not of the treatment. So we use that tool for the psychological service. The the other part of the therapy, of course, like we have the counselor, behavioral health consultant at NorthShore, who provide the therapy to individual coming to need that psychotherapy with the different modalities of psychotherapy, but also the working as a liaison person, mm-hmm. between the mental health, yes. department and the other medical specialty. Right. So that's when it comes like to the point that the patient comes to primary provider or family medicine and they need the mental health services. Yes. And instead of waiting until they would see the psychiatrist, which could be the waiting time would be a few months or something, right. like that, we can work through that with assessing the patient, identifying their needs, and they could provide some consultation service to the primary provider so they can initiate the treatment. Yes. And not to be just waiting, not receiving any kind of treatment.
So I love what you're saying, because it really is a multifaceted issue for every client and patient. It's so complicated. You have the physical, the emotional, spiritual, life purpose, mm-hmm. right. So what you're saying is that team, everything from the psychiatrist to the psychologist to the therapist and to the medical side of things, absolutely. Works together and coordinates. Yeah. That is such a wonderful.
Actually, it's a holistic
approach. That's what got me like actually to the field of the mind and the body soul. That's kind of approach. That's what really.
And I heard that once. We try to fix the mind, and then we try to fix the physical, but then there's that soul. Like we got to bring all three together.
Yeah, absolutely.
Mm-hmm.
Absolutely.
But and what is so nice now is when you go to a general practitioner, oftentimes now, or even a specialist in the medical field, physical medical field, they will ask you about your psychological background, mm-hmm. which in the years ago they didn't do that. Yeah. So we've come a long way, and what you've developed there at NorthShore is really wonderful.
Yeah, and I like it that it's right there at NorthShore. You don't have to go to NorthShore, and then you have to go here, and then you have to go there, and you're just meeting the needs of that patient when they come there.
And that's basically our philosophy there, the integrated model of care, mm-hmm. and would be patient-centered, yes. patient-centered care, mm-hmm. which we provide.
Right. And can you talk a little bit, and I know it's a big topic, but medication, that someone listening might be like, I want medication, or I really don't want to do this with medication. Can you maybe help them with their concerns about that?
Yeah, absolutely. So thank you for bringing that up, because it's really very challenging sometimes with the patients, like, if that would be something like I would like to do, if really like they don't feel comfortable to do, just to think about it, like we are, like in general, like our nature as a human being, we don't like medication. Who likes to take medicine?
Right,
So
right.
we kind of like that. Even sometimes, even with the professionals, they struggle if they have their own medical illnesses. They struggle to
Right.
take medication.
Mhm,
Like
right.
to remember to take it. This understood, and we try to work with the patient to understand what their barriers from the medication, what their fear, what their concerns, and working on that. But some mental illnesses will need to have medication.
Yes.
That's based on the proof of the evidence, proof of the experience, and also the literature. All the data, evidence-based, would provide us with like some mental illnesses would need to have medication, and actually delay that intervention with the medication would make the outcome worse. And
Right.
Then that's when people start self-medicating.
would progress. That would be one of the things, and sometimes also the disease develop resistance to treatment over time. And we found like over years, like the disease is not responding to medical
For
intervention.
all of a sudden, no
Yeah,
specific reason.
Yeah,
Right.
absolutely.
Right. And that they don't have to be afraid, because if that happens, you can tweak it or change type of medications or the amount.
Yeah, and that's what we usually work with our clients and our patients on. Just like we have here, this is the service that we provide. That's why we are available here to work, to follow on that. If you have any problem, if you notice any changes, negative or positive, we have to update us about that. We keep a follow-up appointment with them. And if we need to adjust the doses or adjust the medication, and there's different ways now for intervention, with like many medications available for addressing the mood stabilization, the depression, the anxiety, the issues with like the irritability, even with the addiction field, with the medication that would facilitate or assist the recovery. We kind of like medication assisted treatment. We have that intervention now, which would help and increase the probability to achieve and establish maintaining recovery.
Right. So it's complicated, just like a medical problem. A patient, client needs to be a squeaky wheel and say that I'm feeling a little bit too out of it, or I'm afraid I'm going to get addicted. You know, Dr. Hegazy, what should I do about this? So you'll answer their questions and work with them and try to get them on the right path. And if changing a medication is important, that's available. So they shouldn't fear that.
Yeah, and like we want to just like we want to achieve the stability. That would be like our goal. Like we work with the patient. This is kind of like what we have as a knowledge, what we have as experience, as evidence, would provide this kind of like intervention would increase the probability to achieve stability.
Yeah.
And that would be our goal, like to have a stable life, to have a more productive life. That would be the goal. So we would work with them on that. And sometimes the patient actually would be kind of like very scared or afraid to do this intervention. And we let them like just to give them some time. I usually ask them just to maintain follow-up, maintain coming, even like in a space time for follow-up, but I keep them connected.
Yeah.
And most of the time they come back and say like, I really want to try some medication. I want to get some help with that.
Right.
And that doesn't undermine the other like therapeutic intervention, definitely, because they are kind of all working together.
Yes.
And that would increase the chance to achieve the stability.
Are there any other big reasons why, you know, maybe fear of medication, but any other reasons or blocks that you might want to address that you would say to people, it's okay to reach out and get help, don't be afraid of? Why do people not?
Yeah, I see it's often like having like sharing experience or getting like their experience from other like people, other family member or a friend, and they kind of like they kind of take it and they apply this experience on themselves, and that's what we try to work with the patients on. Like everyone is is a unique experience, so we cannot take that and apply it. If you're a family member took this medicine and they have negative or positive experience, we couldn't kind of extrapolate that and put it on your experience. So we have to make sure we follow with you. Sometimes the genetic component play roles there, but definitely we want to make sure we work with them on their unique experience.
Wow. That is just beautiful. Go
And
ahead,
I was just
Lisa.
gonna say, Hans with addiction, and they finally got him on some medication, and I think that's being treated for like anxiety, and he's been taking this pill every day for 8 years, and it's really just, like you said, it his behavior, his mind just like equalized it, right?
Yeah,
And
it's kind of like giving this stability.
Yeah, gave him that
Yes.
stability, and so his doctor has said, well, let anybody know if you go off of that,
Mhm.
because he's been taking it, just this pill every single day for that, and it's really, really helped him too.
And that's the part also of the mental illness, because it's not like in general mental illness, it's not like that pure science, other medical specialty. So we kind of like, it's not like any other specialty like gastroenterologist or cardiologist where I can scope the person
Yeah,
and
and that's
find
it.
that,
That's
that
exactly
diagnosis, get a piece of the tissue,
And
put it
then you
under
know
the
what you're
slides,
getting.
and you know
Yeah,
what
yeah.
we get, and we have that. But it's actually have that combination of science and art.
That's right.
And the art of working with the patient,
Gosh, that's a
intervening
beautiful
with
way
the
to
Yeah,
patient,
that is a beautiful.
The art of working with a patient.
and
That's a
overall the
beautiful-
resistance, because we see a lot of this resistance, but eventually having the medication as part of the treatment,
Yeah.
that would achieve the stability.
Yeah.
And that medical model is actually like any other chronic illness.
Yes, exactly.
So if I am hypertensive and I stop taking my blood pressure medication, my
exactly.
blood pressure will rise up
Yes,
again.
exactly.
If I stop taking my diabetes medicine, my blood sugar will fluctuate and causing problems. So that would apply also.
That's a great analogy
Yeah,
for
to the-
people to hear about that,
mental
because you
illnesses.
would treat those other things, and that's how you should treat your mental illness.
Yeah.
Right. Well, and it is an art, and as you say, Dr. Hegazy, everyone is unique. So I just thank you so much. Oh my goodness, we
Oh,
could
thank
talk
you.
all day. It is just fascinating. But the fact that, as Lisa said, you have this holistic view, and that you give the client, the patient, space to identify their unique needs so that you can help them appropriately is just a wonderful thing.
Absolutely.
Is there anything else you'd like to mention today?
I think it worth to mention, especially with like my subspecialty in addiction and working in the addiction field for over like 20 years,
Yes.
working with the population. It's really like very important to understand that, especially like the dynamic with the having a like person suffering from addiction in the family, and how to work on that, how the family would intervene with that, and how that would affect the relationship with the family. I see a lot of like the families like need to understand that person would who's suffering from the addiction in need for validation of their trial to get better, validation of their trial to achieve the stability. But meanwhile, they also need like to balance that and get that with what we call it verification. Verification that the person like is in the right track, on the right path of treatment, getting like the right help, and they following what they need to do to achieve that stability. So that's kind of dynamic with the family, like balance between the validation and the verification, and not to over-validate and forget about that, so that they couldn't set like healthy boundaries
Yes.
in the
Yes.
relationship.
Yes.
And if they over-verify and forget to validate the person, that would kind of like make the person feeling down and losing the trust in themselves and the process, and that wouldn't help them to achieve the goals.
Exactly.
For the people who's suffering from the addiction diseases, ask for help. Never give up.
Yeah.
That's very important. It's not anything different than any other chronic illnesses. Evidence prove that.
Yeah.
So like if you just focus on what you need to do, focus on here and now, focus on today,
Yes.
and that would achieve like your long-term plan.
Yes.
I never met with a person in my career over 20 years who achieved long-term sobriety, and he told me that I decided to be sober for 20 years ago.
Yeah.
they always work it on one day
One day at a time, that's right. And that's for the family too,
And to
you
move it
know?
from there.
But I think it's overall, we can only do one day at a time, right?
Absolutely.
And so
Yeah.
we cannot
Right.
worry about what's gonna happen a week from now or what have you, so.
Right.
But you're absolutely right, and I think that's what our family too is, when it came to realize that I needed to help Hans and support him because it was a disease, and getting him the help that he needed to become the whole person that he could be.
Absolutely.
Well, thank you,
Thank
Dr.
you very
Hegazy.
much.
And as you
Thank
said, trust, and Lisa, trust is such a big deal, and with the family members and with the provider. So get your needs met. It's out there to be had. You have wonderful people like Dr. Hegazy and Lisa and her family who've written a book that can help us understand. And I love what you say, that some people go and get help and it didn't work. Don't stop. Keep looking.
Keep going.
Keep going.
Mhm.
So with that, we would say, again, the core is to be kind to yourself. And what does that mean in addictions or mental health struggles, emotional struggles? Is it's okay to get help.
Mhm.
So we wish the best for you and have a great week. Thank you.
Yeah.
Thank you.
Thank you.
If you enjoyed today's episode, let us know by leaving a comment or review and sharing with a friend. All resources mentioned today and a full transcript of this episode can be found by going to our website, www.healingwithconnection.com. A video of this recording can be found on our YouTube channel, and the audio podcast is available on Spotify, Apple, and Google Podcasts.